Welcome back to AM Northwest. A smile conveys confidence and joy, but it's hard to smile when your teeth aren't looking their best. Here to share how implant dentures offer help and hope, we welcome back from Sleep Dentistry Defined, Dr. Heath Lampee. Good to see you again,
Doc.
Thank you
so much, Helen. Appreciate it.
Implant dentures sound kind of intense. You know what I'm saying?
They are intense,
Yeah.
but it's my job to make them easy, predictable, and to make them life-changing as well.
Life-changing. So who comes to you? Who needs implant dentures?
I have patients coming in age from 25 to 93.
No way,
who
really?
need these.
Wow.
Younger patients oftentimes come in because they have really bad cavities. Maybe they really got into the energy drinks, which is actually worse than soda now.
No, really?
Maybe they genetically had bad enamel.
Okay.
And sometimes we have to, at an early age, take the teeth out. And they're generally all diseased anyways, so we get all this infection out. We take the teeth out in one day. We can put implants in the lower jaw and the upper jaw, and they leave with teeth that day.
Wow.
And it's not just regular dentures. Nobody really wants old school dentures anymore.
No,
and
because
so,
they slip, you can't really chew on things.
No, you go skydiving, they fall out.
They fall out, yeah. Because we're all going skydiving and our dentures are falling out.
Yeah, right? And we have to lead an adventurous life.
Right.
So the implants now will anchor the implant dentures, and we have two different kinds now. We have ones that can really rigidly lock in place, like a snap-in, snap-out. That's our most popular.
Okay.
People love it beyond belief. And for some people who don't want anything that can ever be removed from their mouth, we actually have some that screw in permanently that only I can take out.
Now you have a patient, her name's Helen.
Yes,
and tell me about her.
So Helen came in just about 2 years ago, and her teeth had really bad gum disease. She was a smoker at the time too, and she came in, there was no way we could save her teeth, and she'd been thinking about this for years.
Why did she keep putting it off?
Because people are scared.
Right.
You know, they don't want to know what's going on in their mouth. They know something's happening.
Right.
But it terrifies them a lot of the time.
Sure.
So she finally got the courage to come in. And to be honest, her brother had come in about 5 years prior to that, too.
Oh, that's interesting. Wow. Look
so
at the difference.
So this is her after 4 months
this is incredible.
later. So she was able to finally give up smoking. We got all the infection.
Why was no, I don't mean to stop you with this, but why was she able to give up smoking? Because she got new teeth?
Because it was kind of like a new lease on life.
Gotcha.
You know, you do this one big thing, and maybe it leads to another big thing, and another big thing. It's amazing how one decision in our lives can lead to so many other things.
Well, she probably felt better about herself looking in the mirror, right?
Looking in the mirror, but also all the infection that was draining into the rest of her body, infection draining into her sinuses, down her throat, that was gone. The body didn't have to fight it anymore. She wanted to be healthy again.
I don't think people realize how much disease we can get in our mouth.
Yeah,
and how it affects other parts of our body.
Even after 10 years of dentistry, it still blows my mind. The transformations that I see, not only with the smiles and how people feel about themselves, but after 4 months of these implant dentures, they're like different people because that infection is gone from their body. Their heart isn't having to deal with it. Their sinuses aren't inflamed anymore.
Right.
They just have better energy. And they wish they would have done it 10 years ago.
Yeah.
You know?
Now the process for the implant dentures is a little bit longer than just the snap in, snap out, right?
That's right. Well, we can do pretty much all of this in about 4 months. So this is almost an after picture where we took the teeth out and we have 4 implants in there, and we actually are going to snap in that prosthetic.
Right.
And so this took 4 months. We can do pretty much most of the work in one day, but there are some appointments after that first day where we have to fine tune everything and adjust things. You know, I never try to overpromise. You know, I want to be very honest with what we do, and that we can do a lot in a day, but it takes some time to make it perfect.
Do they last forever, for the rest of your life?
This is going to last a long time.
Okay.
So insurance companies will say, you know, a tooth or a denture, they'll last 5 to 7 years. We want them to last longer than that.
Right.
And it kind of depends on the patient. Some people are really hard on their teeth, some are really gentle. We try to encourage people to stay away from chewing ice.
Right, there you go. Makes a lot of sense. And so if you'd like to find out more about implant dentures, contact Sleep Dentistry Defined, 503-646-2273. We'll put that information for you on our website at k2.com. Thank you, Doc.
So much.
Appreciate it.